Wendy, I'm going to have you use our health rinse called Oracare to rinse your mouth before we start any cleaning. This way it keeps me from, it gives me a clean environment to work in so that I don't carry bacteria from over here to this side of the mouth. Just makes everything kind of like a sterile environment, like before you would go into a surgery or something like that.
Okay.
So when we finish your cleaning, I know we put a lot of work into that deeper cleaning. So basically now I want you to stay ahead of your disease, which is periodontal disease. And one way we do that, other than cleaning more frequently, we're going to bring you back every 3 months. I'm going to have you take home that health rinse I had you rinse with in the very beginning called Oracare. Something you're going to use every day forever. Because your disease is caused by bacteria, and that's basically like your medicine. That's how we're going to keep that bacteria under control. We're going to get it out of there every day.
Okay.
Okay? So you're going to be using that, continuously.
Okay.
Okay? Wendy, I know you're concerned about bad breath.
Yes.
Do you remember the stuff that I had you rinse with in the very beginning of the appointment? Well, you remember how I told you it kills bacteria? Bacteria actually causes bad breath. Bacteria and bacteria toxins.
Okay.
So Oracare is great for eliminating all of that.
Okay.
Okay. So it can really help treat your bad breath, and it's something you can take home with you and rinse with every day.
Okay.
All right, Wendy, after we've done that implant, home care is very important to keep this thing healthy, okay? So remember the stuff that you rinsed out before we started the procedure, the blue stuff?
Yeah.
Okay, I told you that it killed bacteria and viruses, and then it also reduces plaque. So I'm going to give you some of that to take home with you, and I want you to rinse 2 or 3 times a day because it will keep it clean and free of bacteria, and it will help heal around the area.
Okay.
So just make sure you do that, and then pretty soon it's supposed to be like one of your teeth.
Okay.
Okay? All right. Thanks a lot.
Yep.